On this Liver Day, we are honored to have with us Dr. S.K. Sarin, Director of the Institute of Liver and Biliary Sciences, and a globally respected expert in liver health. Today, we'll be discussing key aspects of liver care and disease prevention. Dr. Sarin, thank you for joining us. The liver is one of the most vital organs in our body, yet it really gets the attention it deserves. Why do you think that is, and how can we raise more awareness about liver health?
Well, to all my listeners, a very happy, healthy World Liver Day, which is celebrated across the world to celebrate the importance of liver. But how many questions do you have, Nandini, for me?
So I have 8 questions for you.
Just eight. I thought people would like to know much more about liver, maybe hundreds of questions, maybe next time.
Yes.
Well, the reason that liver has not got the due attention is probably because the organ works silently, tirelessly, and gives all what you require without any demand. And people think, oh, liver, hai, it must be working well. But it is your best friend. Keep it healthy, keep it smiling. Liver smiles, you smile.
These days, many young people follow habits like eating junk food, staying up late, and skipping exercise. How seriously do you think these choices impact our liver health?
Well, the word junk food means it is junk. It has to be put into the dustbin. But if you think your stomach and your intestines are dustbins, put that food inside. Otherwise, avoid, don't use it. Sleeping late is not a great idea because the bacteria in your intestines are the ones which process the food. If you are taking late night food, your bacteria will keep awake and they will not sleep and your sleep will be disturbed. And also these bacteria will extract more calories from the same food eaten at 6 or eaten at 12 in the night. So eating late is not a good idea. And lastly, a restorative good sleep is the best thing. Actually, there are only two and a half things which give happiness in life. One is a sound body, healthy body. Second is a good night's sleep. And rest of the world is only half. But we keep running after money. We keep running after ambitious positions or power. But that's only half. If you have the first two, so remaining half, don't bother.
If my liver could send me a message, which of my habits would complain about it the most? Weekend junk binges or those sugary drinks?
Well, if your liver can send you messages, even if it is not a sound, very high pitch, learn to read the messages from liver, and liver will send both these things that you should not have sugary, highly concentrated calorie foods. That spoils liver. The extra calories which cannot be burnt will be converted into fat and stored in the liver. And of course, if you are having junk food and other foods which have lot of trans fat, which have like cheese, burgers, pizzas, they all are in one way or the other unhealthy for the liver because they bring fat which is inflammatory. The food is inflammatory. We think about pollution of the air. Please think about polluting your system with such foods. It's a self inflicted pollution of the system.
So, what are some early signs that the liver isn't functioning properly?
Well, science wise, liver, as I said, is a very sturdy organ. It doesn't make any noise. But if there is an acute insult, for example, a viral infection of the liver, or there is a drug injury to the liver, maybe immediately in a short period you lose appetite, you have nausea, vomiting. You may also get high color urine, jaundice, pain in the abdomen, fever. But if it is a chronic injury to the liver, for example, people who indulge in drinking or those who are obese or they will have slow scarring of the liver and very late stage of that you get swelling of feet, of the abdomen, sometimes blood vomiting, jaundice and even liver cancer. But early signs wise, I would say anybody who is overweight or obese, those who are diabetic, must get their liver checked, or anybody in the family has got blood pressure, or you have high cholesterol or triglycerides, then get it done. A simple test like ALT or SGPT, a 20 rupee test, if it is high, liver is inflamed. Ultrasound will tell you if your liver is having fat.
So, Prime Minister Modi mentioned in the ongoing campaign of Stop Obesity that we should reduce our oil usage by 10%. How do you view this advice from the perspective of liver health?
And first, our gratitude, salutations to the Honorable Prime Minister for raising the issue of obesity and reducing it. He just connects to people, and this has made a huge kind of a revolution of getting good health. The idea with the Honorable PM has given that 10% less oil is actually taking us to the next level, 10% of weight reduction. And oil, of course, to reduce, but also sugars and also extra calories. So eat less, eat type of food which makes you thin and lose obesity. So I think salutations from health point of view.
Is it true that coffee is liver's best friend, or is that just a trending myth?
Well, I must say I have no stocks in the coffee, companies, but coffee is the best friend. Means it decreases the fat from the liver, it decreases scarring, reduces risk of cancer. But I must say that people who are already having liver disease, it is not going to say I take coffee and I am getting better, or that I keep drinking alcohol and then I keep having coffee so I'll be neutralizing. No.
So, at what age do you think that a person should start taking care of his liver?
Well, that's a very good question. I would say right from birth, the child's liver, the baby's liver must be handled with care. Parents, teachers must be educated that they should teach the child, it should not be overburdened. So, not having extra fat is the best way, and looking after, let's say, first 3 years, not to give extra sugar to the child, natural foods, and uncooked food is one of the best ways. So I would say as early as possible, the idea must be instilled. Liver health will give you a good health.
So, what dietary habits should one follow to keep our liver healthy? And can things like green tea and salads actually make the liver happy?
Well, salad certainly, because it has sprouts, which is the food for good bacteria. So sprouts and several other things like turmeric, walnuts, millets, or tomatoes. They are good for liver. An apple is one of the best friends that you can have. So I would say, but salad with dressing is not a good idea because a lot of calories in that. And the green tea is also a good idea. But nobody should think that by having green tea I can have whiskey or this.
So, my last question is say, on the occasion of World Liver Day, what message would you like to share with the public about caring about your liver?
Well, my message is every day is a World Liver Day. Keep your liver in the best possible health. Love your liver and don't insult it either by extra weight or fat or food or by alcohol or by unnecessary drugs. A healthy liver, a healthy human being, and healthy India.
If my liver were to win an award, would it be for the best toxin fighter or most patient organ?
Well, liver should get all the awards that the body can give. It is actually your best immune gland. It fights for all the infections and bacteria. So it is a very good tolerant, no doubt about it. It is a detoxifying, magic organ, and it also is an organ which patiently works. It never ages, it never tires, and it produces bile, which is like your second circulation. One circulation is blood, and second is bile, which carries all your messages. You know, in Indian culture and medicine, pitta is amongst the most important things. Pitta is the agni, the fire, the way you live and the way you remain immortal. You asked me that awareness about liver is less. Yes, instead of 8 questions, maybe 100 questions. Everyone knows high BP, blood sugar, I have sugar. Yeah, they know that I have kidney stones or some similar ailment. But nobody knows about liver diseases. They only know about jaundice. But jaundice is not the only way. It is only in a very few percentage of people that jaundice occurs. So my suggestion is once a year, maybe on your birthday or a day before or after, get your complete body checkup, but also include the liver health checkup, which includes getting a liver function test. Maybe a smaller version can be just ALT, which, if it is high, indicates liver inflammation. And yes, also an ultrasound, maybe once in 2 years or so, to see there is no fat or stones in the gallbladder.